let's go back to the Zoom feed where we have Dr. Hoa from the Governor's Physicians Advisory Group. Good morning, Doc.
Good morning, guys.
Good morning. Looks like you need a beer.
After one this morning. I'm just kidding.
Just a halfer. All right, Doc.
Sorry about that.
Yeah, if we could, let's just start the latest on the quarantine.
The meeting.
Let's start with the meeting. You're right. That's a great place. So there was a meeting last night with the Governor's Physicians Advisory Group. Give us the takeaways.
Yeah, at the meeting, we just basically reviewed the protocol, the quarantine protocol, and make sure that we look at the upcoming list that we're going to release sometime next week, I think, for date on the low and non-low risk area. We'll probably talk about how we approach that. Do we need to do any modification of the formula, the current formula? We talk about important on the pre-arrival PCR and the one that's pending, or what we do with those passengers. So we kind of firm up what we believe that is safe for Guam based on the data that we have in the past month or so once we implement the quarantine the guidelines. So things look good. We're gonna try to twitch a little bit to make it work better for some area because they're kind of in the borderline. But right now, our formula right now probably the best one of them all. We just need to make sure that the area that we're looking at, they are safe to come in.
So are we going to see any new quarantine protocols coming out? Changing it from the whole testing out and the 5-day pre-arrival?
No. So Sabrina, those are pretty much firm. So,
okay.
To summarize real quick, if you come in from a low risk area, according to the new formula, you can go home and do home quarantine, okay, and you'll be fine. Those are very few places like FSM, that have 0 cases at this point that can do that. The majority of people who come in will have either an acute factor or they're going to be home quarantine, and then everyone going to be tested out at day 7.
Right.
So almost 100%. And so far, the number look pretty good. I'm have a little summary from the public health yesterday, and on the Q factor, since we implemented this thing, we caught 22 positive. Those are very good because even the positive, they are in a controlled situation that we don't have to worry about them go out to community and give the virus to anyone. So it's very well, but the key here is that we encourage people to get some PCR testing. Now we stand from a 3 days period to 5 days period because we understand in the state it takes a long time to get the PCR test results come back. We 5-day period now that they come in, and then if they're pending, we still want them to be in a Q factor, not send them home, because you guys know there's few cases that the PCR test is pending, but the patient while on transit to Guam, arrived to Guam, they notified that it's positive. So it's it's very important to have a pre-arrival PCR in order to identify that either you board the plane or not board the plane to arrive here. So, but like I say, it's not easy to get in the state. Guam is very unique that you can get that, you come in and get tested and get the result the next day. We are very lucky here in Guam.
Right.
But in the state, yeah, so.
Doc, can we discuss this? There's a meme. God, I hate to reference a meme, but this Japan has declared Hawaii, safe. It's going around social media. Would you care to address that? And are we going to be making any changes to our Hawaii status?
Both areas, when we make the formula, um, we really kind of didn't know which area going to fall below 5 or above 5. And actually, we don't know at all. So we basically make the formula make sense, take on the number, plug it in, and in some surprise, we see that Hawaii and Japan a little bit off, but they really don't not too far off by point 0.5, point 0.6. So I think we got to look at more on how to approach those areas that it doesn't really quite fit into a formula, and use other modification to kind of clear them to be in the low risk area. Really, they are in the low risk area, but like I say, the formula is very good. It catch 95, 99% of the area, but some fall off of it. So we have to look at other maybe small modification we can do, and they will fall back into the safe area.
Let's just, there's a comment here referencing Dr. Shea, and he was on yesterday. He totally disagrees with the formula that you guys are using. Can we just address that, Doc? I wanted to get you guys on at the same time to do a little pa-pa-pa-pam, but I know you were a little busy yesterday.
Yeah, that part where I think sometimes is Dr. Shea, that's his hometown, and I know that it's kind of fallen off a little bit. We understand that, but again, it's a safety for Guam that we do that, and we can look at that and modify that a little bit because it makes sense, but at the same time, we can look at different modification there because they are relatively very safe until July 11. From July 11 on, suddenly they have a big surge and continue to have the surge. So the question is, we need to find out is why they have a surge. They were very safe before. So, and I'm sure they recover very fast. So, we can still consider them as safe. Like I say, is 5 is the score, and I think from I remember they like 5.6. So they, like I said, we can put some modification there for them to consider safe again. Okay, but again, we because those are only very few areas that is kind of in the borderline, and we look different way to see they really the high risk or in the low risk. Remember, this is something that we just come out and we're going to twitch a little bit, okay, to make sure that we don't declare anyone above 5 as unsafe. But to me, Hawaii is still safe, and so does Japan. So we're going to look at other criteria to see if we can include those areas back into the area where we consider them safe.
Right. I mean, it seems a little much when you guys have to constantly reconfigure what's safe, what's not, what's hot, what's not. Would it be easier to just have the same policy just across the board for everyone, Doc, or are you confident that this is what's working?
No, I'm very confident it's working. This is I'm telling you, this is one of the best form we have. Like I say, I mean, even we make a little twitch, the majority of the area will fall way out that contour, so they are high risk for sure. None of the area in the state right now, very, very few, like 5, 6 states that really didn't come close to that. They're all like 10 or above, so it doesn't matter what we twitch, they're gonna be high. But area like Hawaii, yeah, they can be some modification out there for them to be back in the safe zone again. So, and it's important for us to do that, but we gotta look at other area. I mean, we do listen to Dr. Shea, and we do make some modification on make sure that we cover all our base. Okay, but again, we still going to stay with the flow sheet and the guideline that we put right now. It worked very well, and the recent case that happened that we we know that they work very well.
I wanted to kind of switch topics because you mentioned the 22 that were confirmed from the QFAX, the COVID cases, right?
Yes.
I wanted to ask about the condition of the QFAX and the cleanliness, and because we did have some individuals that were on our show earlier this week, and they were complaining about, and it's not even the first time we've heard these complaints about the condition of the QFAX. And so, is anybody keeping track of that, or is this even something that the Physicians Advisory Group is concerned about or addressing?
You know, that's one area that we talked about last night, Sabrina, and I think that the new director, Mr. Augustine, are going out there, and he's touring with the government and take a look at the Q factor, make sure that they standard, and and we're going to try to create things, before they don't have food, and now some people complain. So I understand that they have some food vendor there, so people when they arrive late can order food from the room. So they as they listen to the people that stay in the Q factor to try to make it, so it's a bit, it's not Dusitani, okay? I mean, it's a
Right.
That's exactly what I said
Clearly.
yesterday.
I mean, they're posting pictures of mold on towels,
Doc, but
stains on the carpet, dust in the vents.
They had hairs, long hairs. I don't know if there are any pubes around, but I'm pretty sure.
Yeah, those are the things that we look at, and and make sure that the amenity and everything is they in themselves. I understand some of them were given cell phone because the room don't have cell phone for them to use, so they try to accommodate them the best they can. Like I say, it's a cost factor. I mean, if you want to pay a lot more, then we probably move to better hotel. But at this point, we just try to meet the standard and try to make sure that people stay there have all the necessities that they can.
Okay.
But if you have.
Let me get in here real quick. Sorry, Doc. Hey, we got to say bye-bye to our viewers on KUAM TV 11 as we're approaching the 8 o'clock hour. Thank you guys so much for watching on TV 11. You can jump on the audio stream, Docomo Channel 10, or, of course, the Breeze 93.9 FM, KUAM, Hagatni Guam, or you can jump on the Facebook live feed, which is on our KUAM News Facebook page. So thank you again for everybody on TV 11 watching. The link on Breeze 93.9. Esta. Okay, Doc, you were saying.
Yeah, the Q factor not going to be satisfied for a few people, and if you get used to stay at the 5-star hotel, you won't like that very much. But I think the majority of the Q factor passenger are not complaining. They're very appreciative of what we try to do for them. So I think that in certain complaints, they all have some motive behind it. So we just have to look at every complaint, to make sure that they're valid. If they're valid, then I'm sure Mr. Snap will work with the Q factor and try to fix it.
Mm-hmm. Well, that's good to hear, because when you look at these pictures and you interview these people, it's like they're going into prison or maybe even worse. I mean, and then for somebody who has allergies, like Donna who called on, and and I have allergies too, and I know I would just go crazy if I walked in and there was dust everywhere. Yeah,
I mean, Doc, I get what you're saying. It's not the 5-star, right? But it shouldn't be a negative 5-star either.
Yeah.
So they're gonna try. I know they have some walking tour on the Q factor. Either few days or next few days. Tour that they're going to try to improve the condition of the facility for people to stay there.
By any chance, did you guys also discuss the tour and the testing that's going to be conducted over at the Department of Corrections?
I think that we have received recently some Abbott ID, the rapid machine, for the quick test, and they are going to assign one or two of them at the DOC and several places, some clinic on the island. So the access to testing and the and the turnaround time is very fast. So I know DOC have one or two machines coming their way, just to make sure that the people in at DOC are safe. So um, um, they are putting machine there. No, even for AMC, we got trained yesterday because we're gonna have the machine put here in Manila for the Abbott quick test. So the testing capacity and the turnaround time, I'm telling you, this is the best anywhere you can find United States. So we will be able to identify and isolate and trace all the positive that come in or exist on the island at this point.
Doc, schools opening August 17th. What are your thoughts on that with the Governor's Physicians Advisory Group? How key were you guys in this process?
The school need to be open. The CDC says it's safe to open. The academy nutrition they say it's open. So it's better for the kid to go to school and have a better education, because the kid at home they have a lot more negative effect than they go to school. They all have implement some guideline there that are very strict. To minimize any risk of infection for the student and the teacher and the worker there. And we try our best we can. We really can't predict it. And the worst scenario is there's a positive case in certain area, and they have guideline to kind of to handle those situations already. So everything is in place for them to start school back in August.
All right.
We had a comment here. Currently in a quarantine facility at Windham, musty, not well taken care of hotel, but food is delivered 3 times a day. Good, clean food. No issues with that. Question though, how can they keep us in quarantine without proving that we have been exposed or confirming an illness? It would not be against the law if we did not volunteer. Well, we've covered that.
Chris, I send you a curve there that
Right.
most people would understand that curve and why we base our decision on testing on day 7 and why we keep them there. Okay. We don't like to do that at all, but we are somewhat a very low positive in Guam right now because what we did in the past few months. And even if they come on island, they just flew in. You cannot pick up the virus if you have any until around day 5 to day 7. Unfortunately, if you test you on the day you arrive, 1 or 2 days, and you can carry on the virus, and you will not pick up on the PCR testing, and you will be released to home, and that's where you walk around and put your family and the people around you at risk. So to maximize the the identification of the virus, we have to wait to day 7, and that curve, if it's, I don't know how to put that in public, but
Right.
they need to understand the curve, and that's the reason why we do it.
Yes.
It's
science, guys. It's called science. Medical, the medical. Listen to the doctor.
It's not that we want to do that, and it proved 22 of them is positive, and they absolutely have no idea if they first come in, but they get sick on the way out. So that's something that is save your family, save your neighbor, save everyone, the public. I really I probably get in trouble in saying this, but the recent case that the people in the hospital, they have the PCR coming in, and it's pending, and and they supposed to be on the quarantine hotel, but just like most people that attend home, we hope that they stay on home quarantine, but majority of people don't do that, and that's how these people get sick, and now we have to worry about it.
Doc,
Yes.
so you're basically saying the patients hospitalized at the Guam Memorial Hospital were on home quarantine and they broke that quarantine.
So you can't argue and get mad at the governor or the pact. We do things because we have data, we have evidence, and we try to protect Guam as much as possible. And you can't argue on the fact. And so that's why it's important for people to understand that curve and not blame, Dr. Cabrera, blame the PAC, blame the governor. They all act in the best means for the people of Guam. And the reason I show you that curve, Christopher, so you understand that, we not just make up things,
Yeah.
that's the stuff where reality is. And we base that on the data. It's not our emotion we do. It's not politics, not any type of financial gain or whatever. This is where I just get back from the state. I feel so much safer here on Guam than anywhere in the United States. The reason we do that because the governor exercise and listen to what the PAC say. So you have to understand. She needs to make the decision, but she make decision on what 20 physicians in the PAC try to guide her.
Doc, can we go back, because I didn't hear your answer. There was a little bit of a glitch on the Zoom. So are you saying again that the patients, the COVID patients hospitalized at the hospital were supposed to be on home quarantine, but that they didn't follow that quarantine and it led to the exposure and contamination of other members of their family?
Yeah, that's where the PCR testing and people question on the PAC decision and the government decision on having the pre-arrival PCR test resort become available before they release off the Q factor. This is where one example where before the Friday guideline that we allow people that have pre-PCR testing that's pending to go to hotel quarantine or home quarantine and expect them to stay home. And this is where the typical, most of the time is that they violate the quarantine and they go out to the community. So, you can't argue why we take necessary step to put the people that have PCR pending in the Q factor until we know the result, because they have it pending, and when it comes back, it's positive.
Wow.
So you cannot blame the governor, you cannot blame the PAC, and make decision on Q factor on the PCR pending. It's pending means you don't know you're positive or negative, and all you need is one case to kind of hurt the community. So it's very important that the people have the right fact before they start saying why we do that. So it's
So they went into
again,
they went into the QFAC and tried to test out.
Or
No,
they
they
arrived
have
with it. They arrived with a pending PCR test. Is that what you're saying, Doc? And then they were allowed to go and home quarantine.
yes, but Chris, Sabrina, that's fixed already.
That's
We
fixed
closed
now.
that loop.
Right.
Okay,
Yeah.
okay.
Because of this, though.
No. We didn't know about this thing.
I see.
We decide on the new guideline Friday that
Okay.
we cannot take that risk, and just this case here just proves that's the reason why we make it.
Got
We
it.
make the decision.
Right, because I thought that that you come in and you have to have that test and it has to be negative in order for you to be on home quarantine.
Now.
Yeah, but based on last Friday it is. Before that, people
could
want
come
to
in.
let and can go home and do home quarantine, which we kind of disagree, but we finally say no, we put our foot down, and at first when the guideline come out, people was complain about it, but they can't complain it now.
Because
they
now we
improved.
have the 4
Right.
COVID cases.
Right. Yes. Well, Doc,
Yes.
thank you so much for joining us. Is there anything in closing that you want to add out here?
for everybody, Chris, Sabrina, the PAC and the governor really do the best we can. It's really nothing about there. People say it's politics. People say it's financial. People say it's whatever reason is. It's not. Okay. All the PAC are all volunteer. We cancel our clinic. We cancel our patient. We spend a lot of time, our own time to try to make a decision to move on forward. And we really ask the people to be patient. We all go through together. We all need their help. Make sure that when they quarantine, you stay at home and not go around, because even when you come from the low risk or you have a pre-arrival PCR that's negative, you still have the next 14 days that potentially you can carry the virus and give to somebody. So stay home, as you know, and don't go around until you have the testing out at 7 days. Okay, when you go home, you have testing out 7 days. Until you have that second test, you need to kind of really watch yourself, because again, we live on an island and we really have to rely on each other effort to keep warm the way we are right now.
Okay.
We hear you.
Got you, Doc.
Thanks, Doc.
And wear your mask, wash your hand, and if you don't have to go to any gathering,
Stay home.
stay home. Thank you, Chris, for yelling.
Yeah. That's the only way I hear it. I don't hear it. If you
Yeah.
say, stay home, be nice, I don't hear it. But if you yell it, then.
Uh-huh. All right,
Okay.
thanks, Doc. Stay
Guys,
safe.
Thank you, Doc.
You're welcome.
Okay,
Yeah,
appreciate
bye-bye.
it. There you go. From the Physicians Advisory Group, Dr. Hoa Nguyen here at 8:14. Hey, we got to take a break. Man, I forgot to ask him about fentanyl.
Oh.
Yeah. Okay. So we'll take a short break. We'll come back with more of the link right here on Breeze 93.9. On the way, we'll talk with Teresa Areola. There's a bunch of stuff going on at Guam Behavioral Health and Wellness Center. Vice Speaker Talina Nelson's also coming on, and